Dr Amichay Meirovitz, hello.
Shalom.
You're oncologist at Hadassah Hospital in Jerusalem, and you're here for the Win Symposium. Could you please first introduce yourself, please?
Hello. I'm Amichay Meirovitz. I'm Israeli. I was studying medicine at the Technion Medical School in Haifa. After that I served several years in the army as an officer in the Golani Brigade. And then I had my residency in internal medicine and in oncology at Hadassah Medical Center in Jerusalem. I went for a follow-up in radiation oncology at the University of Michigan in Ann Arbor for 3 years. Came back to Hadassah, and since then I'm a senior physician at Sharett Institute of Oncology at Hadassah. I'm doing both research and clinical work there. Machon Sharett is one of the largest, if not the largest, oncological institute in Israel, headed by Professor Tamar Peretz, who is a prominent researcher and a physician who mentored the physician in Sharett Institute for their clinical and research work. The Sharett Institute has several departments as the radiation oncology, the medical oncology, inpatient and outpatient units, and the outpatient clinic that are very well known and gather patients from all over the country. We also have a very robust and strong research program, and we do in this research program both personalized medicine, and this is one of the reasons that I'm here. The Win Consortium is an international collaboration with the IGR for personalized medicine, and we do that. My personal interest in research is pancreatic cancer and the extracellular matrix relation to the tumor and the tumor microenvironment. And I also combine with that some clinical studies in radiation susceptibility of cancers, different cancers, and radiation technique to different head and neck or pancreatic or prostate cancer. Currently, I'm in charge of the inpatient department, 34 beds at Hadassah, as well as doing radiation oncology as part of my daily practice with the research, as I mentioned. The consortium here, the Win Consortium, is very important collaboration that can enrich, I think, both sides, the French and the Israeli sides, in inspiration of new research and new frontiers in the front line of medicine. It's very important meeting and connection, as the influence in Israel for many years used to be the American influence, and I think that Israel, both infrastructure and abilities, are much more resembled to the French ones. So we can speak in eye level on many things that can be done together, worked out together with the same humane approach to the people with the same quality of public health in the same countries, and I think it's very important and should be kept.
This morning was the opening of the Win with its General Assembly, and on this occasion you presented to other researchers, other doctors, a few research projects. Could you give us some example of the projects you described there?
My proposal this morning, and it's actually the Hadassah proposal, is to try to collaborate the gene profiling with animal model, and we could see that way if we implant the tumor, not only test it for gene but implant it into mice, we may see if the prediction of the genomic actually work on the tumor in the mice before we give it to the patient. What's happening now is that we take the genomic, predict the treatment, and give the treatment to the patient without testing it before. And it may take 4 or 5 months until we know whether this treatment works or does not work. The suggestion this morning was to do simultaneously prediction with genomic and implantation in mice of the same tumor of the human tumor. Now, when we do that, we can give the man the drugs and the mice the drug, and see if the man responds like the mice, or if the mice responds and the man does not respond, or if both does not respond. And we may come up with such a study, with such an idea, with a solution that will predict in mice whether the treatment works or not working, and if it works, we can give it directly to the man after we test it in mice. If it doesn't work in mice, let's say, we should not give it to the human, and we spare a lot of money by doing that. Or we may see in such a study that mice are not a good model to predict whether man will respond or will not respond. And this is highly important to understand, because then we will abandon the mice model and we'll spare a lot of money by that as well. So that was the basic of this idea.
Dr. Meirovitz, in conclusion, do you have a message to send to our viewers in Hadassah, France?
I would like to thank with all my heart, on behalf of all Hadassah, not only myself, of the great support that the Hadassah organization in France give to our hospital. I think it's very important, the involvement and the support that we are getting, especially in these days where Hadassah organization in general is not in a great position, not also at the Hadassah hospital in Israel is not in a great financial strength. This support is very meaningful to us and helps to keep the good medicine that we're trying to do to all the people in Israel. I would like in this opportunity also to encourage students, medical students and physicians from France to come have some collaboration with us, do some fellowship at Hadassah, work mutually in research with us, and I think this bonding between the people of France and the Hadassah in Israel is very important and very inspiring. Thank you so much for all you are doing. Shalom.